How can I get my child to take medication? When your child is having difficulty or refusing to take medication, there are many factors to consider. But the most important thing is to be honest with your child. We get it. It can be tempting to hide the medicine in their food or trick them into taking it. But when it comes to foster securing and respectful relationships with your child, it's all about building trust and nurturing your relationship on a foundation of honesty. Kids are cleverer than they are often given credit for, and it's important to see things from their perspective to truly understand. Find a way to make taking medicine a process you do with your child rather than something you do to them. For us to answer this question best, we need to understand what the barrier to take the medication is for your child. Once we've established this, we can then provide the most appropriate recommendations. Common barriers for children to take medicine include age. It's very important that we explain the medicine's purpose in a way that they can easily understand and is right for their age. When your child is younger than 2, using pictures or storybooks that show them how the process will work can help them enjoy taking their medicine. If they are a little older and can understand what you're saying, tell them in simple terms why they need to take the medicine. You could also show them an educational cartoon movie to go along with it. Behavioral challenges. Your child may have control issues or conceptual problems about taking medication. They may not like the fact that they are being forced to ingest something that is unfamiliar to them, or they simply do not understand the purpose of the medication. These issues will lead them to act out. Retained rooting reflex. The rooting reflex is an involuntary muscle response in newborns when you stroke their mouth. This becomes a voluntary movement by the age of 6 months. A retained rooting reflex in your child leads to poor articulation and difficulty with swallowing, chewing, and even ingesting solids. Strong gag reflex. A strong gag reflex can make swallowing pills uncomfortable and drinking liquid medication with strong tastes. A struggle since the automatic response of your child's body will be to spit it out. It will also lead them to be fearful or wary of taking the medication in the future. Sensory issues. This can include the taste and texture of the medication, especially with capsules and tablets. When they feel and taste it in their mouth and it is unpleasant, the normal reaction would be to spit it out and refuse to take it. Oral, motor issues. Your child may have difficulty swallowing or giving medication due to oral and motor problems. Physical restrictions, weak mouth muscles, or problems with coordination could be the cause of this. Trauma. Your child may have trouble taking medicine because they have had bad experiences with it in the past, like when it tasted bad or made them gag, or when they were tricked into taking it and then threw up the medicine. In their mind, a bad feeling is associated with that medication. The spotlight effect. Sometimes, kids can feel like they're the only ones doing something, and it can make them feel pressured to do it. You can help with this issue by doing it together with them. The best way to get your child to drink the medicine is to find out the root cause of the refusal in the first place. Once you figure that out, you'll have more options to explore and more resources to use to resolve the issue.